Now we're going to take a look at the contact lens section. Again, you have the scrolling left and right, which isn't necessary, but the main thing is add, delete, edit, bring it down. The multi-add does not currently work as of this taping. I'm going to add a new one. Click the down, and we have them organized for you. And we also have the base curve in there. So let's say the patient's getting fresh look 8.6. You can use the drop down for the power -50, or you can free type if you want to put the acuity in. There's also space right here for base curve again. If the base curve wasn't put in here, you can put it in here. Any over refraction, I never use that. But then what you want for the left eye, if you click this little arrow, it throws the information on the left. So what's on the right now is on the left, and that can save you a step. What's below here is the staff will fill this out with their current brand, what they're currently wearing, fresh look, if they sleep in them, how often they sleep in them. And then down here is the wearing plan that you're recommending. I always recommend putting down the wearing plan because after all these years of seeing patients, I've had a lot of complaints where a patient says, "You never told me I couldn't sleep in these for 5 months." Well, yes I did. So you can see I've made this blue because this little thing has saved my hide a few times. And I put in here 2-week daily wear, no extended wear. And if you want solutions here. The boxes over here to the right, I know you can't read them, but what they say is contact lens centered with sufficient movement. That means you looked at the contacts. This one here, as of this taping, there's a little air. But what it says is I educated the patient about sleeping in contacts and the risk of infection with sleeping in contacts, and I do not recommend the patient to sleep in them. It's long and drawn out, and unfortunately the program is missing its loop mechanism. So what I would do is click this if I were you, and then print a record out one time, and you'll see what all this says. But basically the bottom line is when you click this is you're warning the patient about the risk of infection and loss of sight with contact lenses. And that's saved me a few times also. Patient wishes to stay in the same brand, and I educated the patient on monovision and the effects of decreased stereo, because if the patient has a car accident and they say, "You didn't tell me that I would lose my stereo vision," yes I did. I clicked it right here. Down below here is a little area for free typing. The staff will put in keratometry readings. If you click Make Available to Optical, it puts in final, your name, expiration date. If you don't want that to be final, then you should not click Make Available to Optical and put in trial. Let's say I made a mistake. I don't want that available. So I'm going to change this to a trial. Then you need to go in here and get rid of your name so it doesn't print up, because if the staff see final, they'll dispense it. I'm going to go ahead and make it final. Then you want to click save, and it saves it up at the top. Now you want to print it. Print. That way I just double check to make sure I'm the one logged in. And check their name. I hit the print button up in the upper left hand corner, and we're done. In the upper left hand corner, way over here is a trash can all the way to the left, and all the way to the right is a little save box. You need to make sure you save often, because if you don't save and something happens to the computer, then you've lost that data. In order to get back out of the save mode, you can go into edit, just to be on the safe side that someone doesn't come in and you get up and walk away from this and someone comes in and clicks the trash can. All this data is lost, and you do not want that.